Hello everyone. So today I am here to present a topic on concept of health and disease, which is your under BP 802T code. In this topic we will discuss about the aspects of health, what is disease, what is the dimensions of the health and what is about the disease, how many indicators are there in the concept of health and disease. So, let us start with the definition of the health, which is provided by the WHO, World Health Organization. This definition is provided by WHO in 1948. According to this, health is a state of complete physical, mental and social well-being. In this parameter, there are three things are taken: physical health, mental health and social health, and not merely an absence of disease. So, this point should be noted. Whenever we are saying a person to be a healthy, we are not saying it as absence of disease, but it should have the physical parameter, it should have the mental parameter, it should have the social parameter. All of the parameters should be taken care. What are the other things in this? An ability to lead a socially and economically productive life. So, this is all about the health. Now, coming to the multi-dimensional aspects of health. So, by WHO there are three parameters taken: physical, second is the mental and third is social. In physical health, we are saying that our body is working properly, every cell and every organ, every tissue, okay, they are working in a harmony, they are working well. So, it is written is functioning at optimum capacity in a perfect harmony. Then we will say yes, the person is physically healthy. Second point here is the mental health. Mental health means there is a balance between the individual and surrounding world. It includes intrapersonal as well as interpersonal aspect. Means what person feels in himself or herself, this is under the intrapersonal perspective. Then second is the interpersonal, how is the relationship with the others. So, this is under your mental parameter. Third is the social, means what is the quality or a quantity a person is sharing in a community level, in a society. So, that is under social perspective. This is all about the World Health Organization, but there are other parameters which are also included in the multi-dimensional concept. See, what are these parameters which we can include is the spiritual, okay. This is also defining the health, like part of the individual which reaches out and strives for meaning and purpose in life, which include meditation, yes, how the person is following all of these things, meditation, yoga, yes, what are these aspects? They are coming under the spiritual part. Then emotional aspects. Emotional means what the person feels, okay. There could be happiness, okay, anxiety, a person is feeling anxiety, the person is sad, okay, the person is satisfied, they all are under the emotional aspects. Then next aspects which is added in the multidimensional concept is the vocational aspect. Vocational means which is including physical parameter as well as mental parameter. So, we can say this is conclusion of both of these parameters, okay. Then there are some other parameters also which are included in the multidimensional aspect is the philosophy, okay. There are some things which we are taking from our ancestors. So, that is how we are following those philosophies. This is under your philosophical part, okay, like awaken in morning, okay, take healthy diet, okay, early we are taking early diet, early evening diet, okay. These are some of the points which are coming under the philosophy which we are following from the ancestors. Then there are some cultural aspects also, okay. Our beliefs, our attitudes for the health and the disease, what we are thinking of. So, they are coming under these all of the aspects. Then there are some socio-economic aspects, okay. This is the major part we can say, which is impacting on the health or responsible for the disease condition. So, there are people who are rich, okay. There are people who are poor, and there are people who are in between of the rich and poor. So, these socio-economic condition is also impacting on the health. How? Of course, we know that rich can afford every health facilities which is in the community level, but if we are comparing it with the poor, so poor cannot afford it in a same manner as the rich can, or the upper middle class can, or middle class can, okay. Then environment. So, under the environment we are considering for the society, yes, how the society is impacting, yes, in which society we are living, how they are following the cultures, because this is also impacting on our cultures or on our beliefs. Then there are some we can say pollution also. This is also the part of the environment which is impacting the health or causing the diseases. Then educational aspect means we can say awareness about the health. This we are getting only by the educational or awareness, okay. Then nutritional aspect, yes, nutrition is responsible, this deficiency of nutrition is responsible for many of the diseases, okay. So, we are checking the nutritional status as well. Then curative, okay. So, in some of the diseases we are following the this curative part, okay, means the therapy we are following for the patients, it is under the curative. Then there is a term called as prevention. So, we have one tagline, prevention is better than the cure. So, of course, preventive care is better than to take any disease or to go in this curative stage, of course. So, we are following all of these dimensions which is under the multi-dimensional concepts of health, apart from the three dimensions of the health which is given by the WHO, okay. I hope this is clear to all of you, these specs or these multi-dimensional concepts. Apart from it, in the concept of health and disease, we have some components of the health. So, see, there are basically two components. First component is the objective and the second component is the subjective. So, objective means standard of living and level of living. Okay, so, objective component is defined by the people who are in our society. Okay, so, everyone can find very easily that what is the standard of living, how a person is living, what is the housing, what is the sanitary conditions. Okay, so, that everyone can define it. So, it is under the objective. Okay. The other component which is in persons only, okay, the person, only a person, individual person can define, it is under your subjective parameter. Okay, so, I will write it individual parameter. And objective I will write community can define it very easily. Okay. So, subjective which the individual can define is under the quality of life. So, any person can define, yes, the person is happy, a person is sad, a person is satisfied with his life, what is the happiness index, and every individual has a different level of satisfaction, happiness, anxiety, sadness, everything is defined by the individual himself or herself. So, it is under your subjective parameter. Okay. So, these two components will make the whole well-being of any individual. Okay. Now, coming with the first component, the standard of living, which is your objective parameter. A community can easily define this parameter. So, it refers to the usual scale of our expenditure, okay, our revenue, how much we are getting, goods we are consuming, okay, and what are the services we are enjoying. So, anyone can define it? Yes. So, what income we are getting, okay, in which occupation we are. So, community very well can define these things, okay. Standards of living, sanitation we are following, or our area is following, what nutrition we have, okay. Level of provision of health care in that area. Level of provision of health means we are getting the primary care, or have we the access for the secondary care, okay, or have we the access of the tertiary care. So, this also depend on our socio-economic class, okay. Of course, the rich can afford the secondary or tertiary care, yes. So, these are under the level of provision of health. Then what is the educational status of a person? So, this is defining the standard of living, we can say. Recreational activities in which we are involved, okay, and there are other services apart from it. Now, standard of living, this depends on the socio-economic class I told you. So, the same is written whatever the revenue we are getting or whatever the pay we are getting. So, it is depend on gross national product per capita, okay. So, depending on any country which is rich, of course, their people are also rich. So, they can afford a good standard of living compared to the other one, okay. Now, second component here is the quality of life. So, your quality of life is under the subjective parameter, okay. So, this individual is defining here. Now, by WHO, World Health Organization, stated one definition, and what is the definition here for quality of life of any person? It includes some factors such as happiness, okay, how a person is happy, or any person can number it. Then education, a person is satisfied with it or not. Then social and educational attainments, this is important thing, how a person is satisfied with the life or with the belongings what the person is getting. So, freedom of action of doing anything, so that is a liberty we are saying, yes. Then justice a person is getting, freedom of expression the person have, the rights the person have. So, this all affects the quality of life of a person, okay. So, these two components, the standard of living and the quality of life, both determines the health of a person. There are some indexes which we are using in concept of health and disease, and these are very important. So, we should know about these terms. First is your HDI, okay, and there is also one index here, PQLI. So, I have compared between these two. Now, you can see the comparison here. I have taken a component, which component will take in the Human Development Index, okay, which will define in any country the humans are developed or not, okay. And there is another parameter, physical quality of life index, which is showing the quality of a life of a person. So, these two parameters are compared here, what are the components will take, what the range should have. There are many questions will get in the exam from this area. Then a value for the India, because yes, of course, we will talk about India, what is the value. See components, first Human Development Index includes the longevity of a person, okay. So, a life expectancy at birth, of course, a country which is developed, they have a proper facility, they have the sophisticated techniques, okay, to handle this this disease aspect, okay. They can take care all of these things which are involved with the early death of a person, okay. So, longevity is taken care in the Human Development Index, life expectancy at birth at the age 0, okay. So, this will take, and then the second component, income, okay. So, real gross domestic product per capita, okay. So, depending on the country which is rich, of course, they have a good GDP. Then another is the knowledge a person have, Okay, knowledge depends on the mean schooling of a gross enrollment ratio. Okay, how many children are coming to school, what is the literacy ratio of a particular place. So this is defined in the knowledge by the parameters of mean year schooling and gross enrollment ratio and literacy rate. So these three parameters these components will use and apply it in a formula. So will calculate the HDI index, okay, human development index. So range here is the 0 to 1. Okay. For India we have 0.609. So we need some improvement here, of course. The highest we will see in the Norway, okay, Denmark. These are some countries, they have a good human development index. They have a longevity, very good longevity. They have income and they have knowledge. The children are going to school. The gross enrollment ratio is high compared to the India. So yes, this is about the HDI. Then physical quality of life index, this is the one parameter we are taking in the concept of health and disease. So in this, three components are here. First is the life expectancy at 1 year age. So you can see the difference. In HDI we are taking life expectancy at age 0, whereas in PQLI we are taking life expectancy at age 1. This is the first difference here. In PQLI, physical quality of life index, we are not taking income, we are taking knowledge here. So literacy rate we have counted. The second parameter you can see is the infant mortality rate. So infant mortality rate is number of deaths of children, okay, in age of less than 1 years. Okay, so they are infants who are less than 1 years. So we will take number of deaths per number of live births, okay, multiply with 1000. So this is the formula we are calculating the infant mortality rate, how many deaths are in a particular year per 1000 live births. So this is calculated in the infant mortality rate. We are checking the ratio of these IMR. Okay. On that basis we are saying yes, our country is following good initiatives in the health. Okay. They are making their health to more good, or they are working to decrease all of these aspects which are causing the deaths in the children's. Okay. Then the range here we can find yes, there is a difference between the ranges also. In HDI we are taking 0 to 1, in the PQLI we are taking 0 to 100. So for India it is nearly 65. So these values you should note that what is the range for the HDI in the for the India, and what is the range for the PQLI for India. Okay. Now we are coming to the another index we are calculating apart from the physical quality of life index and human development index. There is one parameter called as human poverty index. Okay. I think by the name you will be very clear that the HDI, human development index, and human poverty index, they are contraindicatory. Okay. Higher the human development index, of course lower will be the human poverty index. Okay. So the same is written here, you can see. It means deprivation in the basic dimensions of human development complementary to human development index. Okay. So they are complementary. Now human poverty index, it is defined for different countries by taking different components. Okay. Now see what are the different components here. Components used for developing countries. So we will take the example of the India. India is a developing country, and components used to develop used for the developed countries. So we will take USA. Okay. USA is developed country. So what are the parameters in which we will define is the country is poor or not. So for different countries we have taken different parameters, of course their status are different, so we will take the different parameters, so we can balance. Now the first parameter here is a probability of a birth of not surviving to age 40. Okay. Here we have taken 40 years of age. In the developed countries, of course we have a higher expectations with the developed countries. So what age we have taken? Not surviving to the age of 60. Okay. So this is under, we will say yes, if they are following this, yes, we will say the country is poor. Okay. Then other parameter, adult illiteracy rate. Okay. Here we will take illiteracy rate for the developing countries, but for the developed countries such as USA, we are taking functional literacy rate, means the people are educated, but they should have they should have some work also, means they should be employed. Okay. So, we are saying functional literacy rate means they should be converted into employment also. Okay. Here we are saying only the person should be educated, we are not talking about the employment, okay, because they are the developing countries, yes, they are working on it. In the developed countries we are talking about, yes, they should be educated as well as they should be employed, they should have functional literacy rate. So, I think this is clear, the terms are clear here. Then third component we have taken here, unweighted average of the two indicators. What indicators we have taken for the country? There should be a proper water source, yes, and we have taken the children which are underweight for the age. Okay. So, these two unweighted average we have taken. Here the third component we have taken is the how many people who are living below poverty line. Okay. Fourth parameter is here for the developed countries, rate of long term unemployment, means which is more than 12 months, which is more than 1 year. Okay. So, these parameters are defining the status of a country, and on that basis we will say yes, the country is poor or in which class, and will give a range, that is the human poverty index. Okay. These all index we are taking care in the concepts of health and disease, and of course, they are defining the health of any country. Okay. What initiative a government will take on the basis of these of the indexes. Then there is another aspect, spectrum of health, means what is the range of we can say phases we can see in between of the good health, okay, means the positive health and the death. Okay. What are the phases we are seeing? Because health is the state, okay, it is only the state, it is if it is changing, we are calling it as yes, the person is under some disease or have some problem. So, these are some of the phases, these are called as spectrum of health. Okay. What are these phases we can see? In between of the positive health and death, we are seeing these phases. Okay. A person could be better healthy, okay. A person could be freedom from sickness. Okay. This could also be one phase with the person is feeling yes, I am free of sick, okay, I am free of sickness. There is a one condition, unrecognized sickness. Okay. So, when the symptoms are not coming properly to the body, but yes, we are exposed to some of the antigen or some of the you can disease agent. Okay. So, this is under the unrecognized sickness. Then we are coming with a mild sickness. Okay. So, we are going to death if we are not diagnosing properly or not taking treatment. So, this is this stage here. So, mild sickness would be one condition. Okay. When we are treating for the disease, we are taking treatment, and there is one condition called as a severe sickness, which is associated with a complication and terminal stage. Okay. Terminal stage, and ultimately will reach to the death. Okay. So, these are the spectrum of health. Then there are the determinants of health. What are the determinants? See, I told you in initial of the slides about the dimensions. Okay. Now, health is the multi-dimensional concepts, and in the multi-dimensional concepts we have physical health, we have social, we have mental parameter, and apart from it I told you there are some other parameters like spiritual parameter, philosophical parameter, what cultures we are following, socio-economic, nutritional, environmental, these all of the dimensions of the health. From the dimensions, if we conclude or we abstract some of the points, so we will make out on the determinants of health. What are the factors which are responsible for calculating the health, for checking the health, okay, which are responsible for making good health, we can say. So, what are these determinants we can see in this chart here. First is the biological. Okay, biological means we are exposed to the bacteria, viruses, okay, fungi, okay, any agent, any foreign agent which has a biological property. So, we will call it a biological parameter, biological determinant. There is a behavioral, okay, by the behavior we are also determining the health. Okay, so, this is a part of the mental health. Okay. Then environment, environment is a very broad term, okay, not only the pollution, pollution could be also of course air, water, anything, okay. Not only the pollution, we are taking the society also, okay, this is also our environment, okay, interpersonal relationship. By this also we are determining our health, okay. So, socio-economic parameter, of course poor, middle, rich, on the basis of occupation we can say, on the basis of occupation or the salary or income, okay, and also knowledge. These all are under the socio-economic. Then what health system we have? So, of course, in the India I am telling you, we have segregated the health system into the rural and the urban, rural and urban. For the rural we have primary healthcare centers, okay. Initially we have the primary health care centers in the rural area, then there could be the secondary also. In the urban we will get all of the advanced care facilities, okay. So, we will get the primary care, we will get the secondary care as well as the tertiary care or any other sophisticated hospitals we will get in the urban, okay. So, this is all the health system we are accessing, okay. Then socio-cultural, what cultures we are following, what are beliefs and attitudes for a disease, okay. Then aging of a population, of course, a country in which the geriatric population is high, of course, the diseases are more prone in the geriatric population compared to the adult age group, of course. So, this is also determining the health of any area or any place. Then what science and technology, of course, the countries which are very developed, they have a good science and technology in area of the health or of course all of the areas. So, we are talking here the health. So, we have these sophisticated techniques in developed countries compared to the developing one, okay. So, we are following, the developing countries are following the science and technology. Then information and communication. So, this is under the awareness, how much we are awareing the people, what are the notifications we are doing, okay. How much the communication, information communication a country is using. So, this is also affecting the health here. Of course, the gender, there are some diseases which are more prone in the males, okay. There are some diseases which are more prone in the females as compared to the other genders. So, see, we are seeing here in the gender group, okay. Then equity and social justice, of course, this should be ideal, ideally existed in any of the place, okay. So, a country should follow the equity, means the equal distribution of all of the facilities to the people who are living in a particular area, and they should follow the social justice as well, okay. So, these are all of the determinants of the health. Then there are some indicators, health indicators. See, what are these indicators? So, indicators, they are measuring the health status of the community, okay. Now, if we are checking the health, the concept in the concept of health and disease, there are some indicators which are very well used for checking the status, okay. So, we are comparing the health status of one country to the other countries also. We are checking what are the needs for the health facilities and implementation if it is required for the countries, okay. The indicators, whatever the indicators we are using for the for checking the health, they should have some characteristics, okay. Those indicators should be valid, okay. They should be reliable, means if we are using it many times, they should reproduce the same results. They should be sensitive, means for whatever we are checking, they should give the means they will check the same things. They should be specific, okay. And of course, for the areas which we are implementing, they should be feasible for that, Okay, they should be true, they should be relevant. So, these are some of the characteristics we are following for the indicators. There are some examples, we will see what are these examples of the indicators, like we can check the health by the mortality, how many people are dying from a disease, okay, how many people are in morbid conditions, how many people are with the disability. So, there are in some complications in some terminal diseases, we are checking the disability rates also. What is the nutritional status indicator? So, we will check the vitamin A, vitamin D, okay, then energy yield, and then protein status, fat status. So, all of these things we are taking in the nutritional status indicators. What are the healthcare deliveries, okay, indicators, how many nurses are there, how many doctors are there, utilization rate, how many hospitalizations are occurring, how many follow-ups are there, okay, indicators of social and mental health. Then environmental indicators, I told you before also, socio-economic indicators, then what are the policies the government is following, these are all depending on these of the above indicators, okay. Then what is the quality of life? Of course, there are some parameters I told you, WHO has defined what indicators will take in the quality of life. So, these are the indicators we are taking in the health indicators, and we are following to check the health. I hope this is clear to all of you. The next part will continue in the next lecture. Thank you so much everyone.